Hello, I'm Dr. Yvette Rubidoux. I'm a member of the Rosebud Sioux Tribe, and I'm the Vice President for Research and Director of the Policy Research Center at the National Congress of American Indians. Today, I will provide a brief update on the COVID-19 pandemic in Indian country. First, some definitions. The virus that is causing COVID-19 infection is called SARS-CoV-2. COVID-19 is the name for the illness or disease caused by the virus that was first identified in 2019. The COVID-19 pandemic term is how the virus is having an impact on communities worldwide. It's an epidemic if it is in a defined area or region. This is a pandemic, and it's still worldwide. Mitigation measures are the actions we take to reduce the severity of COVID-19 and to stop the spread of the virus in our communities. The NCA Policy Research Center has been monitoring publicly available data from IHS and CDC. We have been reporting trends from a public health framework, which is more focused on communities or populations, whereas medical data focuses on individuals. In terms of the data on COVID-19 cases, there's some good news in the data. The data in the slide is for the overall United States. COVID-19 cases are declining in the United States, according to CDC and Johns Hopkins data. As you can see in the graph on the left, this is the total cases since March 2020, which are now around 33 million, but the trend is slowing, as you can see, by the flattening of this total case curve. The graph on the right is the new cases per day graph for the US overall for the last year, and you can see that the trend is declining as well from the highest numbers in January that were over 300,000 cases per day, and now it's under 10,000 cases per day, which is still better, but that's still a lot of people getting COVID-19. And even though these numbers are better, the virus is still spreading, just at a much lower rate than January. This good news is also tempered by the milestone that we have reached over 600,000 deaths in the US from COVID-19. And for comparison, 60,000 people die each year from the flu. So we are not actually back to normal yet. This is the US overall COVID-19 daily case rate in the last 7 days by state from the CDC website. The darker colors are where there are more cases per day per 100,000 people. So in the last 7 days, states in the West and South have the highest rates of cases, which also sort of aligns with places with lower vaccination rates. The trends in IHS data show the same thing. Total cases over the past year, which are now almost 200,000, with a slowing or flattening of the total case curve on the left, and the new cases per day graph on the right is showing a decreasing trend from a high of over 3,000 cases a day in Indian country in January to below 100 cases a day now. Again, this is great news with improving trends, but it's not yet zero. And it is important to remember that these are all likely underestimates of the true cases. While the decreases we are seeing in cases is good news and is most likely due to being the downward trend after the post-holiday surge in January, and the current level of public health mitigation measures, some other things may be impacting trends in the next few months. One is the pace of vaccination. Here you can see IHS vaccination data compared to US data on the CDC website. IHS data are in the light blue and US overall data are in the dark blue on the left graph, which is percent receiving 1 or more doses on the left and percent receiving 2 doses on the right. Percent vaccinated for IHS shows it's lower than the overall US, and the trend in vaccinations is slowing, as you can see on the right graph. There are some examples of tribal nations who are doing great, like near 80 to 90% vaccinated. But unfortunately, the overall IHS data show that there is still room for improvement, and it's not near herd immunity. Of course, there are places in Indian country that are doing an amazing job, and some places are still struggling to get access to vaccines. But not getting everyone vaccinated means variants can develop and potentially escape the vaccines. Another way of looking at vaccine data is by comparing the percent of people fully vaccinated, and this map shows the overall US percent vaccinated by state. The darker states have the highest percent vaccinated of their total population. IHS data is on this chart at the bottom, and by the color of the tab, it looks like it's now in the lowest group when you compare the percent vaccinated with the states. IHS is the light green color, similar to Wyoming or Idaho. So there's more work to do, even though some tribal nations are doing really well. Another possible influence on rates in the coming months are the new variants of the SARS-CoV-2 virus that causes COVID-19 illness. There's the UK, South African, Brazil, and now the Delta variant from India. The UK variant has apparently been in the US at least since November and is now the dominant strain. It's yellow on the bar charts to the left. The more the virus spreads, the more variants can develop and possibly make the vaccines less effective and raise the need for boosters, like the flu shot that you get every year. Now notice there are several variants listed on the right, and the most concerning right now is the Delta variant, which is now dominant in the UK and just starting in the US, but over the course of a couple weeks, it's almost 10% of all strains, as seen in the orange bar to the left. And on the HHS regional map to the right, you can see in the little pie distributions where the Delta variant is more prevalent by, again, seeing the larger dark orange slices in some of those regions. So the way to reduce the likelihood of variants is to reduce the spread of COVID-19, making mutations less likely. And that's why vaccination is so important. It's also important to do everything we can to prevent the spread of COVID-19, even when the trends are going down, because we want to maintain the progress we are making, and because American Indians and Alaska Natives are still among the higher rates of cases, hospitalizations, and deaths compared to most other groups when you look at the available data. In this graph, American Indians and Alaska Natives are in the yellow line in the case trend curve over time, and we are still among the highest case rates compared to other racial and ethnic minorities all the way through to the right side of the trend line. But data or not, we know we have experienced a disproportionate impact in Indian country. So thank you for all you are doing to help prevent the spread of COVID-19. And while all the mitigation measures are changing now in states with lower case numbers and openings, we still have to keep our guard. The best way to do that is to get vaccinated. The NCAI policy research team was so happy to get vaccinated. If we didn't have masks on, you would see us with huge smiles. This is a projection for the US overall from the Institute for Health Metrics and Evaluation, or IHME, at the University of Washington. This graph is the daily cases from last October to today, shown with the vertical line, and the projections out to October this year to the right. This graph of daily cases shows the recent winter surge, shown by the middle purple line. The IHME model projects that daily infections or cases will increase if people become more mobile and try to get back to movement, similar to pre-COVID times, which is the top red line to the right. But if we did better at mitigation with, for example, 95% of everyone in the US wearing masks, the daily cases would be the lowest by October and almost zero, it seems, on this projection. But if we keep everything the same as it is now, that middle purple line there will still have cases occurring. And I just looked and updated this graph, and these projections show an increase in the cases in the coming months, which is higher than the projection last week. And that may be due to the risk of the unvaccinated and the variants. Note that without 95% wearing masks, these projections don't get us to zero yet, and how we act as individuals and communities will determine how much the virus will be spreading by fall. I worry about that slight increase we see in the October projection here, and also note that this is for the overall US. In states with less vaccinations, they may experience surges. And while many states have the same projections as the overall US, the District of Columbia projection is now showing that the daily infections could trend higher depending on vaccination status and how much people move around, similar to before COVID-19. We now publish one COVID-19 situation summary document that summarizes publicly available data on COVID-19 in Indian country each week on Tuesdays, now that IHS only publishes data weekly. You can access this document on the NCAI COVID-19 webpage on the Other Resources page, and the link is listed here. In summary, the good news is that we are seeing cases declining, but we need to keep our guard up, watch the data, get more vaccinated, and enjoy where we are now with the hope of getting back to normal. We also need to watch regional and local cases, especially where there are lower vaccination rates. Thank you for all you have done and are doing to protect your citizens and your communities. If you have questions, email us at research@ncai.org. I have also listed links to NCAI's COVID-19 resource website, our weekly situation summary data report, and the NCAI Policy Research Center. Thank you for the opportunity to provide an update today.